Hi everyone, I hope you're all doing well and staying healthy. My name is Beatrice and I'm going to be presenting to you metabolic syndrome. A typical case presentation would look like this. A 63-year-old Hispanic woman named Ana Maria has recently retired from her desk job that she's held for 35 years. While her children are visiting, they notice an abundance of fast food wrappers in the garbage can. The exercise equipment they got her has dust collecting on it. She lives a sedentary lifestyle. At the sight of this, they schedule Ana Maria a checkup with her doctor. Her doctor weighs her and notices she is obese, has a high blood pressure, and has high cholesterol. When asked about her family history, Ana Maria tells the doctor her family has a history of diabetes, but she herself does not have it. Metabolic syndrome also goes by Syndrome X or insulin resistance. It's defined as a cluster of risk factors that increase an individual's predisposition to coronary heart disease, diabetes, and other health issues. Again, a syndrome is a grouping of symptoms that occur together and cannot be tested for using one single test. How prevalent is metabolic syndrome? 35% of Americans have it, 47% of individuals over 60 have it, and 80% of individuals with cardiovascular mortality have metabolic syndrome. So it's common, and even more than that, with an ongoing obesity epidemic, these statistics continue to rise. While the direct etiology is unknown, there are some risk factors which include older individuals, especially over 60, women, Hispanic people, genetics, and obesity, which we will talk more in depth about on a later slide. As mentioned earlier, to be considered as having metabolic syndrome, one would have to meet 3 out of the 5 criteria. Waist circumference must be larger than or equal to 35 inches if you are a woman, 40 if you are a man. Plasma triglycerides must be greater than or equal to 150 milligrams per deciliter. Plasma high-density lipoprotein, or HDL, cholesterol must be lower than 50 milligrams per deciliter for women and 40 for men. Blood pressure must be greater than or equal to 130/85 millimeters mercury. Fasting plasma glucose must be greater than or equal to 100 milligrams per deciliter. Obesity is a large contributor to metabolic syndrome. When an individual is obese, their fat cells, or adipocytes, are not only increased in number, but also they are increased in size. Their role is to secrete hormones and adipocytokines, and these regulate lipid storage, insulin sensitivity, blood pressure, coagulation, and more, but we're going to focus on those. Adiponectin is insulin sensitizing, promotes glucose uptake, and is anti-inflammatory. In obesity, when adipose tissue becomes dysfunctional, it can result in insulin resistance. Free fatty acids and intracellular deposits of triglycerides and cholesterol interfere with intracellular insulin signaling, so the tissue has a decreased response to insulin. Further, insulin allows glucose in the blood to enter insulin-sensitive tissues such as liver, muscle, and fat. If these tissues cannot obtain glucose as easily, the pancreas secretes more. As we saw in the chart, metabolic syndrome deals with low levels of HDL and high levels of triglyceride. These two in conjunction can lead to fatty plaque, which increases one's blood pressure. These triglycerides are stored in adipose tissue, and as we've learned, dysfunctional adipose tissue results in insulin resistance. Metabolic syndrome is a huge indicator of one's risk to coronary artery disease. HDL cholesterol is the quote good cholesterol because it absorbs LDL, quote bad cholesterol, and takes it to the liver. In metabolic syndrome, if one does not have high enough HDL levels, LDL has the opportunity to build up and form a plaque, which can lead to atherosclerosis and coronary artery disease. Metabolic syndrome is also linked to diabetes, specifically type 2, which involves beta cell function and tissue sensitivity. Pancreatic beta cells produce and release insulin, and insulin receptor substrate 1 and 2 maintains metabolic homeostasis by telling cells how to respond to insulin. In the case of metabolic syndrome, adipocytokines become inflamed and free fatty acids destroy these signaling pathways, rendering them ineffective. So on the left we have a diagram of diabetes. On the left is a normal pancreas that produces insulin. It couples with glucose to be able to move into those cells. Then we have the diabetic pancreas with more glucose in the bloodstream and fewer insulin coupling with those glucose molecules with less overall movement to the target cells. And then we have the diagram of the three vessels. One has a normal blood pressure on the walls and no fatty deposits. The next has some fatty deposits and therefore an increased pressure. And then the last one has damaged walls due to the fatty plaque buildup. This represents coronary artery disease and the reason individuals with metabolic syndrome have increased blood pressure as a means to combat the resistance. Metabolic syndrome cannot be diagnosed with a single test, so we have listed different aspects and their corresponding test. For waist circumference, a tape measure is used. A blood sample is used to examine plasma triglycerides, HDL level, and fasting plasma glucose. A sphygmometer measures blood pressure. Fortunately, there are ways to prevent and lessen metabolic syndrome. It can be as simple as losing 5 to 10% of one's weight. This is because muscle mass metabolizes glucose and triglycerides. Incorporating more fruits and vegetables with high HDL levels can decrease LDL levels. Less salt, sugar, and fat decrease the likelihood of obesity. Lastly, treating metabolic syndrome early on can help diabetes or prevent the onset of diabetes because it reduces insulin resistance so the pancreas does not have to work as hard. In addition, treatment can prevent the risk of ischemic heart disease by lowering LDL cholesterol and therefore controlling blood pressure. If you want to know more, this is a list of the references that I used. And then thank you very much for your time. If you have any questions, please feel free to reach out to me or to Dr. Boyd, and we'd be happy to answer those. Thank you, and I hope that you guys stay safe and healthy. Have a good one. Bye.